Welcome back, everyone, to OpenLine. We are talking about helping police respond to mental health-related calls. There is a program now called Partners in Care, a pilot program that's been going on in Metro, where clinicians ride with Metro police officers in 2 precincts and respond to calls over the course of several shifts. And so we're talking about that program. And we have with us 2 people from the Mental Health Cooperative that really help put this program on. And we have some calls. So let's go to the phones. Let's go to Mike. Hello, Mike.
Good evening, Ben. Good to see you, and good evening to your guests as well. And much kudos to what they do to bring some stability and peace to some very violent situations that they may run into. I have 2 questions. The first question is for the kid in me. Do you get to play with the lights and sirens when you're riding around in the cruisers? On a second question, on a serious note, what can we do as a municipality and government to make sure that we're not always on the reactive side, and what can we do to be more on the proactive side so we don't even, where we can get to a point where we don't even need you or not need as many of you personnel-wise out in the field. And thank you once again for the work you're doing, and I think it needs to be funded as much as possible so we can try to make a difference and save some lives. And you guys have a good night.
All right, Mike. Thank you. All right, do you get to play with the lights and sirens when you go out?
Okay, so strictly, the counselor's not allowed to touch really any buttons in the police car when we're out and about. But I will say that in a parking lot, I did turn the lights on, and it was very fun.
I bet. You deserve it. If you're going out and doing all that, you deserve in a parking lot somewhere to turn on the lights and siren. That's fine.
Oh, it was at the precinct. I didn't want to get in trouble at all.
Sure.
I asked first, hope I don't get in trouble for saying it.
No, I'm sure it's fine. And now, I like that second. What can government do to be more proactive in all of this? What would you like to see done, funded, going forward from here? What can we all kind of ask government to do? Amanda, what about that?
Yeah, I think first and foremost is, we would, of course, like support and expanding a program, particularly if the data continues to show the success. But I think the big thing we have to look at is what happens after the crisis. What happens after these teams have de-escalated someone and gotten them into initial care? Many of these folks need good, solid follow-up care, and that could involve having what's called a case manager, or like a good old-fashioned social worker who can follow up and make sure that they are getting access to medications and that they're getting their basic needs met, like access to transportation, that they're not worried about where they're going to be living. Someone to really help with all of their their psychosocial needs, as we call it. So I really think the next phase of this is really us looking collectively as a group from the stakeholders that are involved in this, is about what happens post that crisis. And thankfully in Nashville, we're a city that's got a lot of resources, and that we do have options that some of the more rural areas don't, but we just need to make sure that we're utilizing those resources to the best of our ability. And then what I would love to see is us going upstream and really talking about mental health in our schools, in our churches, so that we can reduce the stigma and hopefully address people's needs before it gets to where they feel like they have to call 911 to check on their family member. I think we've made a lot of progress in reducing the stigma related to talking about mental health issues, but it still exists. And I think it's important for us to start talking with children at a young age and helping them develop healthy coping skills and knowing where to access resources for them so that we can be more preventative versus reactive.
I've done this show for a while, and we've talked about that for a while. Every time we talk about mental health, destigmatizing, talking about it. But I still feel like there is just this, we hear in the pandemic, mental health issues have just kind of gotten worse. And so do you feel like we're making progress, or do you sometimes feel a bit overwhelmed by what's out there? And this is certainly a great and needed program, but it's just one part. And so where do you think we are big picture?
I can say I think that there's certainly days I think we're making progress, and then obviously there's some days that you think, wow, we've got a long way to go. And, you know, I think it ebbs and flows, to be perfectly honest. I think we've definitely made progress that we're talking about these issues, and that we're not just talking about them within the mental health system, but that we're talking about them with other systems, like the criminal justice system, like, you know, the local health department, and looking at it from a public health standpoint versus just isolating it and talking about it in the community mental health system. But there's such a need out there. And I think we have to really open our eyes to how sometimes our system leads to further problems with many people. I mean, you know, the whole issue of criminalizing mental illness, that's been going on for years, and we're not going to change that overnight. And I think that's what, for me as a mental health professional, and you know, Michael may have some ideas, that's what sometimes gets disheartening, is that you think, gosh, we're not making a lot of progress day to day. But when I sit back and look at where we've come in the last 20 years, 20 years ago, we would not be talking about this level of partnership between mental health, police department, public health. So, you know, it takes sometimes looking back and go, at least we are not only talking about it, but we're problem solving, and we're coming up with solutions that involve public government, they involve nonprofit, and it also involves the community too, because we do need community support to make this successful.
That's a good point. If you sit back and look at where we were 10, 20 years ago, this is a huge advancement. And Michael, you were saying we kind of fashioned this program after what was going on in Denver. This is being done all over the country. And so this is kind of a new phase or a new effort when it comes to policing, right?
Yeah, this is definitely a police reform kind of program, and it's a public health reform. I mean, like Amanda's saying, all of these systems intersect. To really make a difference, you have to collaborate between, you know, like Partners in Care is not just mental health cooperative and the police department, it's the health department, it's the way emergency communications and the non-emergency number, they've changed the way that they ask questions about mental health related calls, better triage that call and get it to the right people. So those are great first steps. We're also working with, you know, Hub Nashville, the fire department, EMS, paramedics. We've started cross training with them for the first time. So we will, you know, be doing some mental health training for the fire department this year for the first time. All of these entities are all here to try to help people, and we're really starting to communicate and coordinate and getting people the best help they can, which is a really hopeful thing for me, because when I have my clinician hat on and I'm in with a person in crisis, you know, I can look back years and see this crisis coming and be frustrated of how the system has failed. But then when I step back and I'm doing my program managing hat, it's great to see the links and the strides we're making right now.
That is great. What about feedback from officers? What are you hearing from the officers who are part of this program? Michael.
I would be lying if I said I wasn't nervous about how the program would be perceived and accepted by the police department and the level of buy-in. I am actually surprised of how, I mean, after the first 3 weeks, the commander of Hermitage Precinct, Commander Higgerson, wrote a letter to the command saying that we need a second clinician. This program is an absolute success. It's already making a difference on how we handle mental health calls and helping the public. Like I said, I have personal stories I can see. Our officers are really happy with the program. All of our officers volunteered to be in this program. A lot of them came up to me during the training, and they may have family who have some mental health history. And you know, they tell me that might have motivated them to volunteer for the program. I see them get on a scene and call me. I had one officer call me who wasn't even in the car with the clinician that day. I was in a different car, but he called us and said, hey, I'm on a call, and it's not related to mental health, but I think this guy is bipolar in a manic phase because he's having this pressured speech. And he listed out 3 or 4 other symptoms of bipolar disorder in a manic phase. And I went there, and sure enough, it was. And I've never been prouder of an officer to pick up on things like that. And just having them say that we're giving them the tools they need to do a better job and a safer job for the public and getting people in crisis better help, it's really made it worthwhile for the officers and the clinicians.
And I love to hear that. And so, Mike, what happened when you showed up in that situation? So the officer says, I think this person's bipolar, manic phase. You show up. What are you able to do? What happens?
Well, In that situation, I was able to talk to that individual, kind of get a mental health history. Something that our clinicians are really great at is getting collateral information. If that person lets us talk to their family, we'll call their family and, get their mental health history from when they were 16 on to now. And, what's happening? Are they in a crisis? Is this leading up to it? Is this a baseline kind of behavior? Is this how they always act? In that case, that person actually was in a manic state that was actually putting himself in a danger. He wasn't able to take care of himself very well. So we were able to de-escalate him, talk to him, build trust, and divert him into the mental health system instead of, getting involved with that criminal justice system, because someone had called the police on him. But we were able to get him the help he needed to kind of get stabilized.
He needs a clinician. And it's rough when we send somebody there who's trained to deal with, dangerous, armed kind of situations. And so it's great that it's certainly not the police officer's fault. They're the ones that have to go there, and they have to deal with these difficult situations. I would think maybe they were initially kind of skeptical, but I bet they're overjoyed to have somebody that can help them with some of these difficult situations. All right, we have to take a break, and then we'll come back. I want to talk about why you chose the North and Hermitage precincts to start this, and just talk about some of the numbers out of those precincts. We'll take a break. Be back right after this.